for his third day of the 4-week training program on the enhancing livestock production and food safety through One Health approach. Uh, Today we have two eminent speakers. Dr. R.S. Kembavi, he is the professor in the Department of Preventive and Social Medicine, KEM Hospital, Parel, Mumbai, and he is going to speak on the topic control of communicable and non-communicable diseases through One Health approach. Second speaker, we have Dr. C. Latha, and she is a Dean Kwasu Phuket, Kerala, and Madam is going to present on topic climate change and vector-borne diseases. So I think now most many participants they have joined. We will wait for again 2-3 minutes, and then we will start. Kembavi sir, good morning.
Uh, Hello.
Sir, good morning.
Good morning. Good morning.
Uh,
There's a problem with my computer. I will be speaking through my mobile only.
okay, sir.
The PowerPoint I had shared with you already.
Yes.
Uh, you can show the PowerPoint. I will say next, next. Then it will be okay. It will be okay, na, sir?
Yes. About the first speaker, Dr. R.S. Kembavi sir. Madam, please.
Thank you, Dr. Vaidya. Very good morning to all the participants and today's speakers. So I'm happy to introduce the first speaker of today's course, uh, Dr. Ravindra Shivappa MV, who is presently working as a professor in the Department of Community Medicine in SGH College of KM Hospital. He has previously worked as an assistant professor, LTMFC, in charge of Dharavi Urban Health Center, MOTCV, TB control, and also he has been worked as an associate professor in community medicine from 2001 to 2009, and he has been worked as in charge of general OPD for immunization IDSP, integrated disease surveillance program, started STI clinic in Malvani Health Center, conducted STI surveillance for MDAC, that is Mumbai District AIDS Control Society. He is a member of core committee of AEFI, Mumbai Municipal Corporation. Um, he has been also honorable principal for local self-government Saurashtra University for DHA. He has started the yellow fever vaccination center in KM Hospital in 2019. He has been a member of advisory board at All India Local Self-Government Mumbai, and he is a member of hospital infection control committee.
बरोबर.
He is carrying a project
बाद में password है वो.
he is carrying project on phase 3 trial on tetravalent dengue vaccine in collaboration with ICMR. Dr. KV has completed 25 research projects, and there are 5 ongoing research projects in his credit. He has completed the project on assessment of newer epidemiological determinants of leptospirosis in Mumbai with respect to rural and urban differences. He has been one of the coordinator for implementation of data for health initiative Mumbai Collaborating Organization, MCGM, Tata Memorial Center, and Bloomberg uh, Philanthropies CDC Foundation for improving the writing of death certificates in KM Hospital and SAIT GS Medical College. In ongoing project, the titles of projects include assessment of epidemiological determinants of undernutrition in children of 6 to 60 months of age in urban slum area of Mumbai, under which he is doing the data analysis. A study on assessment of health needs of women during their pregnancy in the field practice area of a tertiary care center. Under this also, they are doing the data collection and analysis. Another ongoing project is post-millennium development goal assessment of epidemiological determinants influencing maternal mortality in a metropolitan city. Then prevalence of risk factors of cardiovascular diseases among urban slum population, and the mental health status, stigma, and discrimination among TB patients. So these are all various projects which are being undertaken by Dr. Kembavi. And also there are some more projects that is on costing of healthcare service research project, DHR, MOHFW Delhi, assessment of exposure and effect of pesticide on general population study supported by CMR, and epidemiological resource center supported by UNICEF. And in addition to this, Dr. Kempi is actively involved in various activities like in Corona and other whatever outbreaks are going on time to time. And a very important contribution he has been put in KM Hospital as a community medicine expert. So with this very good background, academic as well as research as well as extension, I welcome Dr. Kemvi and invite for delivering the lecture. Delivering the lecture on control of communicable and non-communicable diseases through One Health approach, emergence of One Health approach.
Good morning, everybody. Now I will be sharing my slides because my computer has started working. I will hope so I can share. Okay.
Yes, sir. Yes.
कसं करें स्क्रीन कसं करें एक मिनिट शेअर स्क्रीनिंग तर मग त्याच्यामध्ये पेनड्राईव्हवर घ्यायचं ना कसं करत everybody, and today I will be presenting on control of communicable disease and non-communicable disease through One Health approach. Now, One Health approach. One Health is an approach that recognizes the health of the people in close connected to health of the animals and our shared environment. Here there is interaction between the people, animals, plants, our environment. But this One Health approach has now one of the important aspects should be considered because our population is increasing and is regrowing and expanding to new geographic areas. The earth has experienced climatic change. There is deforestation. There is global warming. There is intense farming practices. Many wrong farming practices are carried out. Therefore, there is drying of the soil, and the movement of the people, animals, and animal products have been increasing due to international travel, due to internet, and all that. Therefore, we are exposed to many environmental hazards and infectious disease, non-communicable disease. So it is very important to be tackled due to One Health approach. One Health approach is a collaborative effort of multiple health science professionals together with their related discipline and institution working locally, nationally and globally to attain optimum health for people, domestic animals, wildlife, plant and our environment. This is the report of the One Health Commission. See, in the human health, animal health and eco health are inextricable link. See that human health, at least 60% of all human disease are due to animal origin. The animal health disease in the food products animal globally amounts to about a loss of 20% in the production. And secondly, the ecosystem and emerging diseases in the last 30 to 40 years result from encroachment of the wild land. We are encroaching the wild animals, wild forest and all that, and therefore there is a change in the demography and this is affect us. See, for example, rabies. There is the disease is no boundaries, so it is affecting all the world. Similarly, uh, influenza and now COVID-19. It is all over affected because of the closeness of our world due to international travel and all that. Uh, and world has become a closed space for everybody. The contacts of animals, human beings, and the disease are increasing. The stakeholders need to work together to find a solution to this emerging diseases, and the pet owners, the health science professionals, the farmers, the doctors, the environmental professionals, the veterinarians, even the administrators, the health policy makers, all should work together to achieve that one health approach so that the disease will not affect the planet. Now, evolution of one health, you have to think globally, multidisciplinary approach should be adopted, multi-sectorial approach should be done, multiple scales, planning, common aims, common problem, finance. There are aims and all of each of the institution and the private, public and all that, but you should go for common aims, take into common aims and fight for the these diseases against these diseases. Working interdisciplinary, intersectorial team approach should be done, and committee participation is one of the important aspect to this one health approach. Our data sharing, knowledge, resources from countries to countries should be very quick. Learning by their experiences from the international world, Indian experiences and other countries world, you should experience the best use of control of diseases done by other countries. Systemic organization should be polycentric, highly connectivity, synchronizing, multidimensional. If you do the one health approach, we have sustainable health and welfare, interspecies equality and stewardship, effectiveness, efficiency will be there. Now, in One Health, it's a wide group where environmental health, ecologist, veterinarian, this is a classical photos where say each of one should work together, veterinarian medicine, individual health, public health expert, public health, human medicine, ecosystem, molecular and microbiologist, and health economics. See, there is a bacterial infection, viral infections, zoonotic infection, biothreats, global health, interventions such as surveillance, vaccinations, sanitation, vector control. Then other we have got now non-communicable diseases which are rise, and it is very much need to have one health approach in this, where Sweden had tried and many other countries have successfully tried. For example, you have cancer, cardiovascular diseases, where human behavior needs to be changed, their diet and the food. And this conference is a very good thing about the food practices which are there should be adopted. Healthy food practice should be adopted. Environmental hazards and exposure to human and animals, human animal bond has increased now, therefore there is important joint and skeletal diseases human and animals should be taken into account. Now, if one health is implemented properly, so what is, if it is appropriate, there are 11.3 million lives saved and many more lives extended via food safety measures, prevention of zoonosis, communicable disease and non-communicable disease. And again, 24.3 million people are prevented from entering to poverty line due to the preventive measures. Then climatic adaptation and mitigation, improved manure management through composting and use of biodigester reduces deforestation and improves plant health, crop yield through higher quality of organic fertilizer. The organic fertilizers should be used as much possible because other fertilizers destroy the soil, and this contributes to the avert so much tons of carbon dioxide emissions. Therefore, it will be good for the nature also. Then monitoring of air, environmental health and biodiversity, monitoring of air pollution, water pollution, noise pollution, important because our health is affected by these pollutions. The management of water pollution should be done meticulously. Improve management of wildlife interface should be carried out healthy activities of agriculture production practices which are not destroying the environment, because we are destroying the soil. We have been agricultural land being to commercialize and all that. Therefore our production has reduced. Now, common One Health issues. What are the challenges in the common health issues? We have got emerging zoonotic disease. Now, one more is the antimicrobial resistance. Is very thing we are seeing in the common health practices also now. Antimicrobial resistance are there due to use of uh, antibiotics sparingly without seeing the diagnosis and all that, and using when the person is not suffering, there is a resistance developed. Food safety, food security is very need of the hour, because food safety affects our body and all that. Our malnutrition, nutrition, our immunity is there. Therefore we should healthy food practices should be adopted. And the vector borne diseases also should be managed, because you should care of our environment, should very important. Environmental contamination, air, water should be avoided. We have got chronic diseases, we have got mental health problems, injuries due to overcrowding, occupational health problems, and non-communicable diseases are developing very much. Now, problems of non-communicable diseases, primarily heart and lung diseases, cancer, diabetes are the world's largest killer, which estimate 38 million deaths annually. Of these, 16 million are premature, under 70 years of age. So, premature deaths are occurring before 70 years. Then, reducing the major risk of NCD by using tobacco users, physically inactive because of the internet, mobile, and all that. People are forgot playing cricket and they are on the indoor paving to the mobile. Unhealthy diet due to fast half life, they are using junk food, McDonald food, and all that. Harmful use of alcohol is being done very much. Therefore, that is there. Preventing NCDs prevents, if you practice healthy practices, 82% of the premature can be prevented through the One Health approach. Now, One Health approach. What is about One Health approach is peoples who protect human, animals, environment, health, and other partners by means of coordination, by means of coordinating, by means of collaboration to achieve the best outcome for the people, animal, plant, our environment. That is One Health approach. So that is we should coordinate, we should communicate, collaborate, multidisciplinary team should work together to achieve the best health outcomes for the people, animals, and planet, and our planet should survive. That otherwise there will be climatic change, there will be flooding, the unseasonal rain, and all that. That is affects the environment very much. Now, involving experts, human health, doctors, nurse, public health practitioners, epidemiologists, animal health, veterinarians, paraprofessionals, agriculture workers, environmental and other experts need to communicate, collaborate, and coordinate activities, including law enforcing measures, policymakers, agricultures, experts, communities, and even pet owners. No one person or organization or sector can address the issue of animal, human, environment, and interface alone. Therefore, should be work in coordination. Then only the will be succeeding in One Health approach. Now, priorities intervention at the population level to prevent and control non-communicable disease. The good value of money, including regulation, taxation on tobacco and alcohol. The taxation should be done. Unhealthy use of this should not be done. regulation of food rules, the laws, food laws, and all should be strictly implemented. The unhealthy food should promotion of healthy foods through transport marketing policies, including improved packing of commercial product and revised facial strategies should be adopted. So unhealthy food should not be adopted. For example, you take South Korea, North Korea, who banned McDonald because they are this McDonald food is unhygienic, oily, fried, and is therefore they did not allow. We should encourage local food which are healthy, which are practiced, and give them license, unless unnecessary outsiders who coming here and unhealthy foods. Even the McDonald in charge also for the, if anybody consume McDonald food, then within 2 to 3 years continuous consumption will lead them to heart disease and diabetes and hypertension and all that. Therefore they had restricted his employees to not to it. Therefore it is very harmful to the people. Government should take initiative to this. Unhealthy food should be avoided in the market. Commercial products can be reformed to reduce salt, saturated fats, sugar consumption, and healthy literacy can be adopted by educating health risk people. These commercial products which are there, the healthy education should be given to people to adopt healthy practices. Active living and mobility should be encouraged more. Now in certain parts of Mumbai, at least when you go in see Vileparle area, Sunday there are no vehicles allowed in the roads, so that people can walk, jog, and mobility can be done. Therefore this active 1 week at least mobility should be allocated to the people. Air pollution is responsible for millions of deaths. Therefore we have to have control over air, water, and this pollution so that our health is preserved. Now individual care at different level of type, therefore very important, the health living practices should be adopted in pregnancy. Healthy nutrition and regular physical activity should be adopted by the pregnant women. And the unborn children are affected with the air pollution because if pregnant woman is exposed to air pollution, tobacco use, and maternal consumption, the child which is born is small for date and is not equipped to, his immunity is reduced. Therefore we should care of our pregnant women who provided healthy nutrition, regular exercise, and the maternity leave should be given. The infancy exclusive breastfeeding to be adopted. Facility for breastfeeding at workplace. Universal paid maternity leave should be strictly implemented even in private, public. Restrict inappropriate marketing product to which compete with the breastfeeding and vaccination. Usually what happened, the breastfeeding the mother goes to the work, therefore child is given the outside product which are unhealthy and which affect the child, and that's very important. And vaccination of infant should be carried out meticulously, because what happened, these products under 7 or 9 diseases under infectious disease can be prevented by even vaccination only. It is proved technology. Childhood, the physical activities, healthy diet, healthy promoting schools, nurseries, kindergartens, active travel to schools such as safe footpath and cycle lanes. They're very important in urban areas, especially. We have no safe footpaths, and the physical activity, children have no playgrounds, and the diets which are there, when they come to on the way, they eat the junk food which are adopted roadside. Therefore in roadside also the junk should not be allowed to be sold. And this can be taught to health education in the schools, nurseries, and the school administrators can implement this so that the children will adopt healthy practices of food and all that along with the parents. The adulthood and old people promoting healthy food options. The canteens, opportunities, initiatives of physical activity. The canteens are under control of the organization. They should see that in their canteens healthy food is served. And the health policy should encourage healthy behaviors of the adults and the old people as well. Now prevention of infection, I told about non-communicable disease and prevention and infectious disease. Frequency of interaction between animal food production from the human consumption, increased use of transportation, increased mobility of people across the globe. These factors act as a determinant for increase. Therefore there is more interaction, more indirect contact, and more diseases are occurring. Over 60% of the infectious disease and 70% of women emerging infections are zoonotic, with 2/3 originating in wild or domestic animals. Now, measures for successful disease control. Understanding the disease transmission pathway. Any disease should be understand why it is occurring, how it is occurring, so that we have to tackle the roots rather than superficially. Most of them prescribe the antibiotics, and whatever the cause is there, it is not been seen. Then strengthening our surveillance. Our surveillance system should be strengthened to identify what different diseases, what are there, why they are affecting, how they are affecting, how can we prevent them. And intervention, the public health intervention should be adopted to limit the disease. Then complexity of health and environmental challenges need to evaluate in an integrated and holistic manner to provide comprehensive understanding. Any disease is there, the team of doctors, the veterinarians, the health doctors, the medicine people, and the clinicians, and the paramedical people, the committee specialists should work in interaction, so that they have to tackle this in together rather than the clinician handling it superficially and more disease occurring again, and the problem is not solved. Therefore, measures of disease control should be adopted properly. Then system, what is the silo-based health system? Is a health system in which people tend to hide the data. They don't want to disclose our malnutrition status, our death records, because the politician will interfere, or the administrator will say what you are doing. For example, any hospitals or in a country or a state does not disclose how many cases of infectious diseases are occurring, how many these are there. They say that our measures are good. The silo-based health system is a hiding health system which does not tell. We should have open health system whereby whatever problems are there should be discussed, so that we don't hide the problem and come to a conclusion. Decision makers for preventing disease prevention and control should utilize one health approach to prevent for prevention of the illnesses, hospitalization, death, and economic burden experienced during the disease epidemic. During public health emergencies, an early warning system to combat epidemic should be implemented. The Global Outbreak Alert and Response Network (GOARN) collaborated with institution and network to pool this human and technical resource to fight the outbreak. This was used during COVID time and it has worked excellently, but it should be used for other diseases as well. But it was only used for COVID. It is still used for COVID-19, but other diseases are not into this parameter. When now COVID is reducing, we should inculcate other diseases in this, so that virtual data will be collected. The critical decision to initiate a disease response is often reactive. So whenever disease occur, we suddenly we reactively handle it by giving antibiotic cocktail and all that, and understanding the core concept why disease is occurring. Urgent need to in rapid changing environment with little or incomplete information available and biased information available, so we take the decision very reactively, and because of that initial stage of COVID-19, because of return, many deaths occurred, which would have avoided by if you had been collaborated with national international people to find the solution. The traditional medicine system provides regular data update. However, this system are inherent retrospective, delayed, limiting with utility of real-time data. So our traditional surveillance system where data is hospital based, which is manual, and the data is entered by the data entry operator to this should be based. Nowadays we have Google data is entered, the virtual data where each health institution can enter in the Google format, so that it will reach the administrator immediately, so that if any increase rise in case can be handled. So whatever traditional system should now be upgraded, where the data is virtual and Google form, internet through, and this should be accessible to all. Now, outbreak response. During infectious disease outbreak, the coordination and communication of preventive studies such as vaccination and treatment, support deployment, and management of crucial public health resources is very important during epidemic. And COVID-19, it was excellently utilized. We have in a short time we had a COVID-19 vaccination where vaccines were available to the people, so that would control the COVID deaths. One Health approach would bring about scientists, public health officials, and researchers from academia, industry, government in open projects and develop tool to address the specific disease prevention challenges. The tool could be programmed to predict the disease. So this where international UK, USA were involved in it. Many agencies were involved to predict the disease, what will be there in each country, to help each countries to adopt healthy practices and prevent. And vaccination was given to all the people of all over the world, but certain third world were missing. Therefore, re-emergence of disease occurred. Trends with addressing specific need for engaging decision makers and real world scenario should be put, tool should be used for that. Then continuous surveillance of wildlife and domestic livestock in these limited areas for early detection pathogens may yield faster and more economical results, which our the surveillance in animals is lacking, and therefore whatever diseases which are prevalent in animals which are there seen should be continuously surveillance should be done. One Health approach is expected to provide a good understanding of drivers of spillover event from hotspots, dwellings, fauna to interface humans, which will enable disease prevention and control at the source, while forecasting accuracy, visualization, communication, collaboration, partner management, state and local health management perspective, pilot projects, and other issues in hand. The One Health approach was very meticulously used in COVID-19 and it was very successful, and similarly should be used now to other diseases as well. Now, in the stakeholders that collaborate toward the outbreak are the MOHF, the Ministry of Health Welfare, MOHEF, Ministry of Environment, Forestry and Climatic Change, MOA and FW, Ministry of Agriculture and Farmers Welfare. So MOHFU, the assisted states in provision of supplies for prevention and treatment. NCDC assist state in active search, researching and contact tracing. ICMR, which played a crucial role in COVID-19 by identifying the virus and the vaccination and all. NIV provided referral diagnostic services to that. State departments should provide clinical and diagnostic and treatment facilities. Surveillance, active search for cases, contact tracing was excellently used in COVID-19. Uh, in committee members reporting of health facilities as per key messages, uh, following laid down burials, community practices, adopt key messages and precautions to be taken and adopted themselves for the disease, media providing correct information, not spreading rumors, administration, travel advisory to contain spread of the disease to other state, closure of schools and colleges to continue, private health institution for diagnostic and treatment facilities, the forestry department and animal disease assist in confirming the infection event. This is the stakeholders which are there uh, in India who are working meticulously for this, and more collaboration is needed to in future vendors as well. Now, outbreak response using One Health approach. A successful zoonotic disease outbreak response requires the ability to detect the outbreak using established surveillance system, including event-based reporting, adequate laboratory capacity to confirm the outbreak etiology. So we should have adequate laboratories as well. Work trained man force to respond and perform descriptive analytical epidemiological studies, animals and human disease, both ability to implement appropriate control and preventive measures. Second, an outbreak and emergency management system is placed to coordinate with multi-sectorial response activity at a national and subnational level. See, we have got laboratories, zoonotic very few laboratories are there, but they should be collaborated with the interstate, state, between India, throughout India, Bhopal. There are high security disease investigation lab, National Institute of High Security Animal Disease, Indian Institute of Agriculture Research, Premier Institute of India for Research on Exotic and Emerging Pathogens Animals, NIV in Pune is there. Then Chennai Genetic Research Laboratory, Niven. Uh, uh, these labs are there, few labs are there, but they should work in integration with other. Hello, can you listen to me? Hello.
Yes, sir. You are
Yes,
audible.
sir.
Yes.
Now, for a disease to be controlled, if One Health policy is implemented properly in using the veterinary and all that, intervention before illness in animals. So first, if animals are examined properly and the disease is identified in the animals, epidemics in animals, then intervention before illness occurs in human beings. So animals are covered, then the humans is automatically product. Intervention after the illness or disease. So clinical diagnosis is done early and managed early, then we can prevent human illnesses as well as animal illness. Such outbreak can be prepared. This is cases and timely graphs which by surveillance we can identify the diseased animal and control the epidemic as early as possible. Then this is the activities which are very important to prioritize methods, priority of zoonotic diseases, semi-qualitative tool, workshop, consistent multi-sectorial team, One Health, multi-sectoral collaboration, promotion and strengthening effective use of resources, assessment of zoonotic burden. Due to our surveillance data, we should know what is the burden, which diseases are more common, measurement of cases of illness, hospitalization, disability, quality life adjustment, economic cost, death. This should be analyzed by the data available with zoonotic disease. Assist in identifying priorities. So which disease is more prior, which is in the community should be given more priority. Zoonotic disease surveillance, evidence-based medicine, indicators-based surveillance, syndromic surveillance. If tests are not able, syndromic surveillance should be carried out. Mechanism of data sharing and disseminating should be there. So each and every state or the district to share the data of zoonotic disease which are there. Early identification of outbreak, opportunities for preemptive actions, evaluation of preventive and detection and response program, joint human and animal outbreak response. Suppose a disease occurring in human being, whether it is animal origin should be identified. The veterinarian should be invited to identify what disease is there so that the disease outbreak can be controlled. Joint training of human animal health experts should be there. Cross sector emergency management system should be there. Early detection and prompt control of zoonotic outbreak should be carried out. Now, perception of One Health. So usually the perception of the One Health is that concerned over the effective implementation of One Health system has been expressed by those in veterinarian professional, medical profession, wildlife specialist, and by environmental specialist, whether it will going to work or not. But we have seen the work in COVID-19 has worked effectively. So similarly, other diseases will work, but we have to work together. The recent and rapid emerging of One Health has attracted attention of health policy analysts, social scientists, and humanities scholars. They too have identified similar concern. Then there is general acknowledgement of potential of One Health to strengthen the collective action across borders. So general acknowledgement of potential One Health strengthening the collective action should be carried out. Leal and Bruman suggested that the vision of One Health is hindering both by dysfunction in the governance of global health and shortcoming in articulate One Health agenda. Then interdisciplinary collaboration is an heart of the One Health concept. Yet the execution of One Health, excepting influenza, has largely remained within the discipline of veterinary medicine and animal health. So this execution is not there, but whatever there, only influenza it is been implemented, while rest it is not because we have other zoonotic diseases which are still there. We have got rabies, we have got leptospirosis, which are many cases are occurring in human beings and animals, but this can be controlled if you take help of the veterinarian, and we are fighting individually. You should do collectively. Notwithstanding the endorsement by different medical organizations as a list on One Health initiative website, mainstreaming of medical support of One Health is largely confined to individuals with close veterinarians. So usually it is One Health it comes, and it will veterinarians will be only involved. Medicine, there is a hesitance on part of the clinicians, the veterinarians, that what will happen to our So indeed, someone in medical professions are reported to see that One Health has a veterinarian land grab. I will grab, they will be in more limelight. No, we have to work for the welfare of the society, not individual. Individual field is different, and the see how COVID-19 has affected so much people largely because of there. Therefore, there is nothing like that. Consider that there are those in the field of human medicine who see One Health as a field being championed primarily by the veterinarians and are suspicious of their motive. So there is a motive that they will take all the opportunities. Hesser and colleague in 2012 noted that the reaction from the people working in the health professional is polarized. They are polarized. They feel that we are great, others are not good, ours is the best, others is not. It's not so. Each and every faculty is important, each and every fields are important. Women experts, the veterinary experts and environmental experts are very important. Their consideration of cause of disease to identified. So it is the epidemiological, the cause of the disease is interlinked with the environment, the agent, the host, and the environment. If both, if anything is affected, then disease are. If there is this is called the triad epidemiology. If there is a disturbance in any of the agent becomes wild, then it will spread. If the host becomes defense is reduced, then the disease arises in the host. If the environment is disrupted, so we should preserve the environment. Majority One Health West, major professionals working in animal health are interested in this concept. Therefore, we should work together to the health of this uh, to One Health, implement One Health. Now, to conclude, there is a need of creating knowledge and awareness of One Health policy. Because most of them does not know what is One Health, what anybody is doing, or everybody is uh, working separately. Creation of a platform for stakeholder for international, national, and district level. There is no joint forum for where doctors, veterinary clinician, veterinarians come to and meet the discuss, because there are many cases occurring in leptospirosis in the in KM Nair. Then they should come together with the veterinarians, see why these are occurring, where how the animal and animal contacts are there, and they should uh, come in contact with the environment is also why these cases are occurring in the area. There is any stagnation of water, or there's contamination of the soil which has occurred because of that leptospirosis is rise. But there is no, I don't see any platforms at the national, in national level, state level, at the district level. In Mumbai itself, there should be a veterinarian who should be there involved in management of lepto cases are rise. Then involve him in where give him the data where they are occurring, why they are occurring, and take his opinion, so that we can uh, prevent the disease in the animals, and automatically will prevent the disease in human. But there is no confirmed platform where we should interact. When cases rise, we come, and then when cases rise, they forget that. So usual coordination should be there. Creating a standard operative protocol about One Health concept at a strategic operational level. This is very important. Creating a standard operative, I mean to say, take a problem, then create a stakeholders in what disease is there, who are involved, cardiologists are involved, who are involved, community medicine physician are involved, which veterinarians are involved, or the health specialists are there, or food people are involved, food contamination occurs, therefore disease is there. So we should have a stakeholders for particular disease. For example, your cardiovascular and this disease are increasing in a rise. So we should have even schools and colleges, because the incubation period of a non-communicable disease is 10 to 12 years. If you want to educate to prevent communicable disease, this non-communicable disease, the intervention should start in schools. The health policies should be adopted that unhealthy food should not be there in the market. Discourage use of this. The development in the health education should be given to the school children and the school the parents, so that they should adopt healthy living practices. Then only we'll be able to tend non-communicable diseases. Just doing exercise, fitness, and all that is there. But if healthy practices are not adopted, the non-communicable disease is a very much protocol. For example, now you see about the microbial drug resistance. In drug resistant, it is said that we see that it is said that in chicken, when they use the antibiotics, so that the animal does not suffer from the disease, uh, then this food is eaten by us, and automatically there's the antibiotic resistant human being as well as animals. So meticulous use of antibiotics in animals as well as human being, so that there is no drug resistance, should be seen as well as minimal. So to increase the mass production, or to do this, if unethical practice are adopted, to increase the size of the, I have heard that conference, to increase the production and all that, unethical or harmful, which affects the genetic material or which affect the human beings and even the animals also. The diseases can be spread from animals to human beings. That is what happening in COVID-19 and other diseases which are there, where animal diseases which were previously animals have now transferred to human beings. Similar, if hazardous measures are used, then the human beings can be affected in the long run. So improving the community economic level, on the contrary, very important that the community economic level, when will it increase? If we have got healthy people, healthy nutrition, healthy environment, healthy lifestyle, public hygiene is there, tree planting is there. If tree plants are not done, if there is deforestation and all that, there will be global warming. Automatically the environments are very important, but environments are all not taken into consideration. And agriculture practice, healthy agriculture practices should be adopted, so that the increase in the food consumption, and food is therefore there is no lack of food and all that, the people will practice. And eco farming is the need of the hour, because the farming, we are on the food farmers. If we produce food, we have got food. Otherwise we have to do in the animal food also. There are now, we have got poultries and all that which are there, where hygienic practices, ethical practices, so that no flouting should be done, unnecessary use of antibiotics or anything will harm the human beings as well as animals. So that it's very important to adopt healthy practices. So to in One Health policy is very important in One Health, that we should work together to um, toward the society, to that earth survives. Because of the global warming, there is now flooding and all, many deaths are occurring and all that due to flooding and all over the world, not only India, but it's happening the developed countries as well. So One Health, I feel the One Health approach is the only solution to tackle the problems of communicable disease, non-communicable disease, and the food practice, unhealthy other non-communicable disease. And with this, I end my presentation. And now this is my presentation is for discussion. Thank you very much.
Thank you very much, sir, for a very nice presentation. You have covered all the aspects, including the evaluation of One Health in the different diseases, zoonotic diseases you have mentioned, and what are the issues, common issues related to One Health that you have covered. Mainly the communicable and non-communicable diseases, and the approach related for the prevention and control of communicable and non-communicable diseases that you have mentioned. Also, the measures for the how we can proceed for the successful disease control, by including the silo-based health systems in the One Health approach, and also you have mentioned that you have stated that the creating the need of the awareness for the knowledge related to the whatever the One Health policies are there, and overall the improving the community economic level by improving the uh, environment as well as public hygiene, then tree plantations, agriculture, eco farming, so that all the aspects you have covered in your very informative presentation, sir. Thank you very much for your very valuable time. In short period of time, you have accepted our invitations. Thanks a lot. Now, the 2, 3 questions from the participants. If you have questions from the participants, they can ask.
They can ask the question on the chat also, they can ask, because some, if they don't want to come forward, they can write the questions on the uh, messages as well.
I think no questions, sir. And in the chat box, they have mentioned that many participants that very elaborative information, very good in presentations. So that are the appreciations for you, sir. So thanks a lot, sir, once again for
Mm.
your very nice presentation. Thank you very much.
Thank you, sir. Thank you very much. And so I will stop sharing. Thank you.
Now we have second eminent speaker. We have with us today Professor Dr. C. Latha Madam, and she is presently working as Director of Academics and Research, Kerala Veterinary and Animal Sciences University, Kerala. And Madam is going to present her talk on climate change and vector-borne diseases. So before start the lecture of Madam, I request Dr. R.S. Gandage Madam to give the brief introduction about Dr. Sri Latha Madam. So Patil Madam, please.
Thank you, Dr. Vaidya. A very warm welcome to all, including speaker. It's my pleasure to introduce Professor Dr. C. Latha. As introduced already by Dr. Vaidya, she is working as the Director of Academics and Research, Kerala University and Animal Sciences, Kerala Veterinary and Animal Sciences University, Kerala, India. Dr. Latha is a PhD holder in the discipline of food hygiene and veterinary public health and has diplomas in food safety and quality assurance as well as in One Health. She has more than 27 years of teaching experience as faculty at Kerala Agricultural University and Kerala Veterinary and Animal Sciences University. She is serving a university in several administrative positions as Director of Academics and Research, KWASU, since April 2022. Faculty Dean of Faculty of Veterinary and Animal Sciences, 2017 onwards. Dean, College of Veterinary and Animal Sciences, Manoti, 2017 onwards. University Head of the Department of Veterinary Public Health, 2005 onwards. Management Council Member, Academic Council Member, Chairman of Project Coordination Committee, Chairman of Board of Studies, Chairman of Faculty Research Council, Head of NABL Laboratory, Implementing Officer of School of Zoonosis, Public Health and Pathobiology, Director Board Member of University Cooperative Society, Campus Development Officer, NSS Officer, and President and National Vice President of many professional associations. She is selected as the Academic Council Member of Tanuvas. Dr. Latha is a recipient of many awards like KH Merit Scholarship for BVSC and AH program, fourth rank for BVSC and AH program, ICR Junior Research Fellowship for MUSC, ICR Senior Research Fellowship for PhD, second place in GP Sen Endowment Award in 2001, PG Nair Endowment Best Teacher Award in 2009, Fellow of Indian Association of Veterinary Public Health Specialist in 2014, Fellow of National Academy of Veterinary Sciences in 2001, Reddy Sherikar Outstanding Public Health Veterinarian Award in 2021, and Best Paper Presentation Award in 2010, 12, 13, 14, and 15, 15, 16, and 17. Again, many more years he has got this in uh, in uh, in Kerala Science Congress, Kerala Veterinary Science Congress, and IAVP HS seminars. She has completed 35 research projects funded by many funding agencies like Indian Council of Agriculture Research, Kerala State Council for Science, Technology and Environment, and Kerala State Plan. Dr. Latha has guided 13 PhD, 62 MUSc, and 11 MSc PG diploma students. She has published 125 research articles in reputed national and international scientific journals, 4 books, and has presented 190 papers in several national and international seminars and symposiums. Her special field of interest includes research on zoonotic diseases, food hygiene, and quality control in food production system. Her exceptional skills were manifested by a successful conduct of several national and international seminars, webinars, and symposiums. Her leadership, persuasiveness, and initiative are exhibited by yearly conduct of World Zoonosis Day program with awareness campaigns on no zoonosis to no zoonosis and quiz program in various schools. She was instrumental in establishing NABL accredited quality control laboratory for water testing in the Department of Veterinary Public Health, catering the need of the public in evaluating drinking water quality. Under her tenure as faculty dean, the Faculty of Veterinary and Animal Sciences contributed the most when called to own the prestigious Chancellor's Award for Young Emerging University in Kerala consecutively for 3 years, that is in 2017, 18, and 19. Under her able leadership, the institution showed significant improvement in infrastructure with the establishment of a multi-facilitation center, state-of-the-art examination hall, and library complex, guest house, and hostels. The establishment of a referral diagnostic facility with biosafety level 3 is underway. So with such a very vast that experience in all the field, that is including administrative, research, and academic, we are happy to have today Dr. Lata as a speaker in this 4-week course, certificate course. So I invite Dr. Lata to deliver the talk on climate change and vector-borne disease. Dr. Lata, please.
Thank you. Am I audible, Dr. Vaidya?
Yes, madam, you are audible. You are
And can you see my screen, this PowerPoint?
yes, yes.
No?
It's visible, madam.
Yeah. Okay.
You can put PowerPoint mode. Yes.
Yeah, PowerPoint mode.
Slideshow. You can do slideshow.
Is it visible?
It's visible. You can maximize the size.
Yeah.
Slideshow. Yeah.
Just 1 minute. Huh?
Yeah.
Is it in slideshow mode now?
No, it's not in slideshow mode. It's not visible.
It's not visible. Just 1 minute.
Yeah. Till that time, I request all the participants, you start your video for the group photo. Start your videos for the group photo.
Can you see now?
Yes, yes, it's visible, madam. You can start. Yes.
It is visible. Is it in slideshow mode?
Yes, yes, madam.
Yes. Okay. Okay. So, okay. So, good morning to you all. Can you hear, Vaidya?
Yes, you are audible.
Okay, so first of all, I would like to thank the organizers, my close friends, Dr. Jende, Dr. Vaidya, and the whole team behind the conduct of this training program, for inviting me for presenting this paper. And my paper is on climate change and vector-borne diseases. So we all know nowadays, so many diseases are there. Means so many emerging diseases are there, so many re-emerging diseases are there, and the occurrence of the diseases are on the increasing trend. It is highly prevalent nowadays, the diseases. And among the various infectious diseases, the vector-borne diseases plays a very important role. That means about 17% of the infectious diseases comes under this particular category, that is the vector-borne diseases. And as per the World Health Organization report, statistics shows that about 1 billion people are affected per year annually due to these vector-borne diseases, and about 7 lakhs deaths occur due to the vector-borne diseases. So this is one of the important issue nowadays. And we know the climate change. Nowadays, this climate change is every now and then the changes are occurring to the weather, to the climate. And that is one of the important reasons for the occurrence of these vector-borne diseases. That is why I have included both the climate change and the vector-borne diseases in my presentation. So first, let me see what is climate and what is weather. We know the weather is only for a short period of time, and the climate represents for a long period of time. That is the major difference. So climate means average trend of weather patterns for a given location over a long period of time, and the weather, it is what happens at a given locality over a short period of time. That means it determines, the weather determines the immediate outbreaks and the disasters, and the climate determines ecosystem health over time. So what is climate change? The change to the climate, that is a change in the state of the climate that can be identified by statistical tests, by changes in the mean, and that persists for an extended period, typically decades or longer. That's the climate change. And the climate change may be due to there are two major classifications. What are the reasons for the climate change, occurrence of the changes in the climate? It can be, first is the natural, and another is the artificial or the man-made or the anthropogenic changes. So the climate change may be due to natural internal processes or external forces, or to persistent anthropogenic. We are responsible for that. That means the man-made changes in the composition of the atmosphere or in the land use. And it is estimated that average global temperatures will have risen by 1 to 3.5 degrees centigrade by 2100. That means within next 78 years, the total temperature may rise up to 3.5 degrees centigrade rise may occur in the global temperature. And this is the latest report by IPCC, that is the Intergovernmental Panel on Climate Change, IPCC 2022. And we have seen the determinants of climate change, anthropogenic and natural. The natural include the solar radiation, the ocean currents, the forest fire, the volcanic eruptions, meteorites, then the methane gas emission from the plants and all, and the anthropogenic or the man-made, or we are the culprit in this. That is, the main thing is the deforestation, then the greenhouse gases, production of the greenhouse gases, then the synthetic fertilizers and chemicals excessive use, then change in land use pattern, and the industries, the pollution from the industries, then the unplanned urbanization. So these are the major determinants of the climate change. And 5 major consequences of climate change as per the World Health Organization. So the agriculture sector is affected a lot, and the quality as well as the quantity of water, the drinking water is affected. Then high temperature effects, there will be increase in the temperature. Then the natural disasters, there are so many natural disasters are occurring nowadays, including your flood, including the some storms, and such so many things are occurring nowadays. And also the rainfall, changes in the rainfall, that is the changing temperature and the patterns of the rainfall. So these are the major consequences of the climate change. And this, we all know the greenhouse effect, due to the greenhouse gases, and that is the major reason for the global warming. And actually, this greenhouse effect is the beneficial thing which maintains the temperature, warmth of the earth. That is essential. That is very much essential. And previously it was in the ice age, and to maintain the temperature on the earth's surface, this greenhouse gases are very much essential. But this global warming is very much essential. But that was a beneficial thing. So the radiations from the sun rays and sun will be absorbed by the earth's surface and keeps the earth warm. So that is beneficial thing. But when there is higher quantity of these greenhouse gases, what will happen? Large amount of this emitted back, the radiations will be absorbed back, and that is responsible for increase in the temperature. Otherwise, the infrared rays, so much quantity of infrared rays will be emitted back to the space, and that will be taken back and absorbed by the greenhouse gases, and that is responsible for the global warming. And this is one of the major problem, and that is faced by the people, and the people as well as the animals and all the living beings on the earth. So now the greenhouse gases, we know there are so many different types of greenhouse gases, including your carbon dioxide, including your methane, then the nitrous oxide, then various chlorofluorocarbons, then hydrofluorocarbons. Also, all these comes under this greenhouse gases. And principally the carbon dioxide, mostly from the fossil fuel combustion and from the forest burning, and other heat trapping gases such as methane from the irrigated agriculture, animal husbandry, and oil extraction, and the nitrous oxide and various other human made halocarbons. And on the other side, the left side, you can see the trend in the concentration of the carbon dioxide. It is increasing like anything. This is from the year 1984 to 2020 is given, and see upward trend in the concentration of the carbon dioxide. And this graph is the methane concentration, that is also showing an upward trend, and the concentration of these greenhouse gases are increasing like anything nowadays. Culprit, we have seen it as the carbon dioxide, and see the graph. This is from 1960 to 2010. This the Keeling curve of atmospheric carbon dioxide concentrations measured at Mauna Loa Observatory. Now, the global warming we have seen, and these are the four warmest years: 2016, 2020, 2019, and 2015. So when you see from, when you calculate from 2010 onwards, 2021 has got the seventh position, so it is also warmest. So 2016 is the maximum warmest year, and the global mean temperature anomalies with respect to 1850 to 19 for the five global database. This is the warmest year, and you can see the increase in the temperature. So this is the temperature is increasing, and this is from 1850 to 20. See the upward trend from the 20 onwards, it is showing the upward trend. Variations in Earth's average surface temperatures over the past 20,000 years. So this is the picture. Now we stand, and it starts from 20,000 years back. So that was the ice age. It was fully ice covered on the Earth's surface, and when the temperature increases and it is in the positive trend, then emerges. And in between, when it was 300 years back, again it had gone to the ice age, means ice period, especially in Europe in the 15th and 18th centuries, and from there again it's from 1940 onwards. So this is the picture, and now we are here, and from there this is the targeted figure, and the temperature will be increasing in the 21st century. Very rapid rise in the temperature is occurring, and because of this, the temperature increase in the glaciers are melting. That is the major problem that can occur due to this global warming. and the glaciers are melting. A mount, this is the photo of the Mount Kilimanjaro in Tanzania mountain glacier, and from 1912 to 2000, 82% of the glaciers lost, and by 2020 it will be 100%. That means the ice caps will be melting, and that is responsible for the flood. That means the increase in the rise in the water level, and Arctic ice caps are melting. So see the picture of the polar bears, how happy they are in the first picture, and see the situation, how difficult, how with great difficulty that polar bear is standing on an ice cube because of this melting of the glaciers. These animals are also finding so difficulty, and they are also in the verge of extinction now. And see the picture of this is from the Antarctica. So Arctic and Antarctic areas, the glaciers are there, and it is melting, and huge and gigantic cavities are formed in the glaciers. So this is a picture of a gigantic cavity formed in the glaciers in the West Antarctica. So two-thirds of the area of Manhattan and almost 1,000 feet tall, growing at the bottom of the Thwaites glaciers in the West Antarctica, is one of several disturbing discoveries reported in new NASA-led study. So this is the gigantic cavity formed in the Antarctic glaciers, and the glaciers are retreating. And in the hydrological year 2016-17, we have seen it is the warmest year. Observed glaciers experienced an ice loss of 0.850 meter water equivalent. That is the unit used to designate to explain the water loss. 0.850 meter water equivalent, and the preliminary estimates of 1718 indicate about zero point 0.7 meter water equivalent loss of water. With this, 7 out of the 10 most negative mass balance years were recorded after 2010. And because of this melting of the glaciers, on the other side there will be increase in the sea level. No doubt for that, the water has to flow down, and there will be increase in the sea level. And more than half of the world's population lives within 60 kilometers of the sea. So you can imagine the dangerous situation that can happen due to the melting of these glaciers. And see the level of the water, sea level, increasing the sea level in this graph. This is from 1800 to 2100. And for each 3-month period in 2018, the ocean heat content in the upper 700 meter and upper 2000 meter were either the highest or the second highest on record. So the sea level will be increasing, and there will be increase in the temperature on the sea top. Ocean heat content will be increasing, as well as there will be acidity also will be increasing due to this. And so that means the pH will be going down, and that is responsible for the acidification of the ocean. So ocean heat content increases, and the ocean acidification increases. And so this is acidification also. See the pH, and it is coming down, and that means the ocean water is becoming acidic, and that is that creates very dangerous situation to the marine ecosystem. So this is the picture of the marine ecosystem, and my dear friends, you know this marine ecosystem. The terrestrial ecosystem is, when you compare to this terrestrial ecosystem, marine ecosystem is the most beautiful thing. Whatever is there under the ocean is very beautiful, and you can't imagine how nice it is. It is very colorful, and you can see on the left hand side, you can see the coral reefs. And actually there occur the symbiotic attachment. The coral reefs are attached with the different types of algae, beautiful in different colors. You can see the different colors of algae, that is the dinoflagellate, and they occur a symbiotic life. That means this algae produces the nutrients with the help of the photosynthesis, and the reagents that is required for the photosynthesis is provided by the coral reefs, and also it provides the accommodation. So that is a symbiotic life, and these dinoflagellate, different types, different colors are there. And actually actually, this is the picture of mine. I have gone for the scuba diving, and this dinoflagellates. The peculiarity of this is that. When we try to just to touch them, these the scuba divers, they used to give strict instruction not to touch, because many of these dinoflagellates may be poisonous. But if you just show your finger, they will just go in, and after that, when there is no enemy or nothing like that, they will again come out and spread with flying colors. That is the situation, and it is very very nice. And because of this acidity, increase in the acidity of this ocean, this is what is happening on the other side. You can see the bleaching of the coral reefs. That means the death of the coral reefs occur, and the death of the dinoflagellates occur, and that is the situation. That means the marine ecosystem is affected too much due to this increase in the acidity, increase in the temperature, increase in the ocean heat content and all. So that is another important problem with the global warming. And another problem is with the precipitation patterns are changing. Nowadays, we know we can't predict the rain, when it will rain, when it won't rain. Actually, there was a clear pattern arranged, or a strict pattern for the rain, the precipitation, or the whatever the rainwater we have received. So there was a regular pattern for the raining and all. And now we can't predict when the rain comes, when the rain won't be there. Like that, we can't predict at all, especially in Kerala and all. Nowadays also it is raining. Actually, the rain didn't stop. I think it is continuously it is raining, and we can't predict. It is unpredictable now. So the precipitation patterns are changing like anything, and increasingly variable rainfall patterns are likely to affect the supply of fresh water, and also it's likely to affect the life of the man, animals, and all the living creatures on the earth. And there are so many other problems that are occurring. The natural disasters are occurring because of this global warming. This is the California fires. It occurred, means it prolonged for longer period, California fires. And then the Hurricane Michael in Singapore, and the Kerala floods. Kerala, this is the picture of Kerala floods, and also the polar vortex. Kerala floods that happened in 2018, and it was the severe flood happened in Kerala. And so the Hurricane Florence or Michael in 2018 in USA, they triggered around US dollar 49 billion in damages and over 100 deaths. Super Typhoon Mangkhut affected more than 2.4 million people and killed at least 134 people, mainly in Philippines. Then more than 1,600 deaths were associated with intense heat waves, and wildfires in Europe, Japan, and USA cost nearly US dollar 24 billion US dollars in USA. And the Indian state of Kerala suffered the heaviest rainfall and the worst flooding in 2018. And I have included few photos of that. So the extreme weather events change in the frequency and the intensity, and it will destroy the houses, communities, and lives because of these disasters. And so there on one side there will be flood, and immediately after that, within 1 month and all, there occur the drought. And that is why these are all these unpredictable climate and the weather conditions affects the life difficult on the earth. And these are the pictures of where flood occurred in Kerala. See the beautiful bungalow and what is happening to that bungalow due to this during that flood. And in a study conducted in IIT Gandhinagar, it was shown that nearly 50% of India currently facing drought, 50% of the country in drought, and 16% falling in or the extreme category. So once there will be flood, and immediately on the other side there will, and that is how the changing pattern is occurring. So that's about, in short, about the climate change and the problems that is occurring. And now we can see the impact of climate change, the direct and the indirect effect on ecosystem and the food web. So the crop production will be affected, the animal production will be affected, and the fisheries production will be affected. So it has got impact on food safety, on food security, on human health and environment, and also gross domestic product. So all this will be affected. And one of the major thing that is affected due to this climate change is the occurrence of the diseases, and among that the vector-borne diseases. That is one of the important things that can occur due to the vector-borne diseases, occurrence of vector-borne diseases. So the vector-borne diseases are the human illness caused by the parasites, virus, or bacteria that are transmitted by vectors. And the vectors can be of different types, like your mosquitoes, your ticks, your lice, your fleas, and all these can act as the different types. Different types of vectors are there, and different varieties are available now. And 17% of the total infectious diseases comes under this particular category, vector-borne diseases. Every year, there are more than 7,000 deaths from diseases such as malaria, dengue, schistosomiasis, human African trypanosomiasis, leishmaniasis, Chagas disease, yellow fever, Japanese encephalitis, then you are this Zika virus, all so many diseases are there, and onchocercosis. So many vector-borne diseases are there, and this is as per the World Health Organization WHO 2020 report. And now the concept of ecosystem. What is ecosystem? It includes everything. That means the vectors, the host, the pathogens, and the biological controlling mechanisms, and all the environmental factors that have an effect on disease epidemiology within a defined spatio-temporal region. So that is called as the ecosystem. And the climate, various aspects of arthropod vectors' life. So what are the changes that can occur due in the climate in the factors affected? So you can see the English will be affected, the survival rate will be affected. It can affect the population, number of the vectors, as well as the vector pathogen interactions between the vector and the pathogen, and then within the vector, of the how fast it occurs, the pathogen replication, the multiplication of these organisms within the vector, then the vector behavior, and of course the vector distribution. So these are all the areas which may change due to the changes in the climate. Now, understanding of the influence of climate on vector-borne diseases ecosystems allowed greater ability to forecast the vector-borne disease outbreaks in the current ecosystem. So that is very, very important. Once you know what are the changes that can occur due to the change, we can very well predict the occurrence of the vector-borne diseases, and that is very much essential for checking out the various control measures for the prevention and the control. Very much important. So forecasting is possible. So in case of West Nile fever, influence of the periods on West Nile fever epidemiology in the North America was integrated in surveillance and risk prediction fever disease in California and Florida, and El Nino and Southern satellite imagery that included temperature and rainfall information was used to predict a Rift Valley fever outbreak in Africa. So once we can predict diseases, it will be very easy for us to immediately for the control of this disease, as well as for the control of the already occurring diseases. Okay, now the drivers globally. What are the drivers of that globally? So first is the hello, Dr. Vaidya.
Yes, madam. All the participants are requested. Please mute yourself. Please. Yes, madam. Continue.
Okay, so the major driver responsible for the occurrence of the vector-borne diseases, and also there will be climate variability, then urbanization, then invasive vector and pathogen, trade and human movement, then land use, water storage and irrigation, and atmospheric composition. These are the important drivers of the vector-borne diseases. And the vector-borne diseases, it can be of two types, mainly categorization. Can be zoonotic, or it can be anthropomorphic. That means animal vector.
India and Sri Lanka మధ్యలో ఏముంది?
Okay, now animal vector, animals to through vector to animals through vector, and from there it will transmitted to humans. And like that, the human vector human transmission, that means the anthropootic infection, human vector human transmission, and from the and the best examples are the malaria, dengue, yellow fever, and all, and the animal vector animal, and the zoonotic. From the it goes to the zoonotic, that means the examples are the Lyme disease, hantavirus disease, most of the viral diseases, including the West Nile disease, the West Nile disease, and all. And the vector-borne disease dynamics. One side it is the human is there, then the vector, then the pathogen, and the factors responsible associated with the human are the migration and the vector environment. The factors associated with the vector are the survival, life production, or the breeding patterns, and the biting behavior. Sorry, the factors associated with the pathogen are the survival, transmission, replication in the host. And now the effects of temperature on the vector and the disease ecology. That is very, very important, and we have to know what are the changes that can occur within the vector and within the pathogen that is present in the vector due to the changes in the temperature, changes in the humidity, changes in the precipitation, and all. So as temperature rises, the vector metabolic rate, biting rate, and frequency are accelerated. The metabolism of the vector increases, the biting rate of the vector increases, and the feeding frequency with which it feeds from the host, that also increases, leading to enhanced egg production. There will be more production of egg and more population size, increase in the population size. So as the temperature rises, these are the changes mainly occurring. And another important thing is that the less efficient vectors, the dormant vectors, will become more and more active and more efficient when there is increase in the temperature. And daily survival rate of the vectors decreases. That means actually there occur an upper limit exists beyond which the temperature is detrimental. So up to a particular level increase in the, there will be increase in the biting efficiency, feeding efficiency, and the population. And the more efficiency, the dormant vectors will become more efficient and more active, and they starts biting the vector, the host very fast. And when the temperature increases to a particular limit, then it will be detrimental, and it affects all these factors, and the vectors will become, the population size decreases or and the geographical distribution of vectors is affected when there is increase in the temperature. So, and this that is about the vector. And what will happen to the pathogens already present in the vector? So, within the vector, range of viral infection, increases, then virogenesis increases, and the transmission dependent. So to a particular level, all these increase by to a particular level of the temperature to optimum temperature, all these increases, the virogenesis increases, the virus replicates at a very faster rate, and the transmission also occurs at a very faster rate. And when the temperature increases more than that optimal level, then all these things decreases. So that is the effect of temperature. And the effect of humidity on vector and disease ecology. So humidity. If there is relative humidity high, then favors most of the metabolic processes in vectors. As the temperature increases, when the humidity is there more, then metabolic processes also increases, and the prolongs survival. Although increased susceptibility to fungal and bacterial pathogens may offset disadvantage. Increased humidity, there is more metabolism occurs, and the more breeding occurs, and the population size increases, and it prolongs the survival rate of the brand. The thing is that when there is increased humidity, we all know the fungal growth will be much, much higher, and so because of that, there is chance for that may offset this advantage. There is low relative humidity, it decreases the daily survival of many arthropod because of dehydration. When there is dehydration, another possibility is increase in the blood feeding rate. They will be going on feeding more and more blood. They will suck more and more blood in order to compensate this water loss. So the low humidity causes aggression, and there is more chance for blood feeding rate. That does not occur in all the cases, but in some cases there will be more and more greedy, and there will be due to this hunger, there will be feeding more and more, and the feeding may increase. Now, the extrinsic incubation period, you all know what this extrinsic incubation period is. Actually, we have studied this when we have studied about the dengue virus disease. So, extrinsic incubation period is nothing but the incubation period within the vector. So, suppose a particular patient is there, dengue patient is there, and the mosquito bites that dengue patient virus, it gets entry into the mosquito, right? The dengue virus is there within the mosquito. When the dengue virus is there within the mosquito, it can't transmit the disease immediately to another susceptible host. It will take some time for this particular virus to replicate and to become a sizable number. After that only, it can transmit the disease to a susceptible host. And that particular period is called as the extrinsic incubation period. So from the picture, you can see the den virus infected viremic person gets bitten by the mosquito, and the mosquito ingests the dengue virus in blood meal, and the dengue virus replicates in the mosquito within 8 to 12 days before able to transmit the dengue virus to another susceptible person. So this particular period, that is the 8 to 12 days in case of dengue virus, is called as the extrinsic incubation period. And once this mosquito bites a particular susceptible host, the dengue virus will be transmitting into that susceptible host, and within that host, it will take some time for developing the symptoms, and that particular period is called as the intrinsic incubation period. So the infected mosquito bites another person and transmits the dengue virus, and the dengue virus replicates in person 3 to 40 days before symptoms onset starts. So that is the intrinsic incubation period. So extrinsic incubation period is within the vector, and the intrinsic incubation period is in the host. And the numerous studies on this extrinsic incubation period examining the constant and the variable temperatures have shown that it decreases when the temperature increases. That means there will be more infectivity. The extrinsic incubation period decreases to less than 8. It may reach to 6 to 8 days. So that means within that period, within 6 to 8 days, this mosquito can transmit the dengue virus to a susceptible host. So when the temperature increases, the extrinsic incubation period decreases from a threshold until a maximum above which the EIP increases again. So the temperature, again, there will be an optimum temperature. If the temperature is more than that, there is chance for increase in the EIP, extrinsic incubation period. Now, the related changes in the rainfall, humidity, and the El Nino Southern Oscillation may alter the quality and the availability of some vector breeding sites. That is also very, very important. So because of these changes in the climate and all the breeding sites, we know the breeding sites, if there is suitable breeding sites, then there will be increasing in the population of these mosquitoes and other vectors, and also the incubation period of dengue virus reduced from 12 days to 7 days, 6 to 7 days, within 5-degree rise increase in the temperature in Aedes mosquito. So the extrinsic incubation period will be reduced. Now, the effect of climate change on the vector-borne diseases. So this is the table. Is it clear?
Yes, yes,
Whole things are clear now?
it's clear.
Yeah, okay. So these are the, so actually there are so many vector-borne diseases, and we can't cover all the diseases, but this is just a few important diseases I have included in this. So first is the malaria, and the vector we all know it is mosquito, and the relevant climatic factors is given in the third column heading, and the effect of climate change is given in the fourth, and the relevant climatic factors, the temperature, rainfall, humidity, El Nino related effects, and the sea surface temperatures. Then the effect on climate change The disease distribution will be affected, the pathogen development in the vector, development, reproduction, activity, distribution of vectors, transmission patterns, and the intensity will be affected. And the next is the leishmaniasis, and the sand flies are the vectors, and the relevant climatic factors are the temperature, precipitation, and El Nino related effects. And the disease, the effect of climate change is on disease incidence and abundance, behavior, and distribution of vectors. And the third is the Chagas disease. The trichomin bugs are the vector, and the temperature, precipitation, and humidity are the factors, climatic factors. And the vector distribution, increased infestation of houses by the vector. And the fourth is the onchocercosis, the black flies, and the temperature is the climatic factor, and the transmission intensity will be affected. Then the tick-borne encephalitis, ticks are the culprits, and the temperature, humidity, and the precipitation are the factors. And the vector distribution, phenology of the host seeking by the vector is affected. Now the dengue, yellow fever, chikungunya, West Nile fever, and Rift Valley fever transmitted by the mosquitoes, and the temperature and the precipitation are the factors, are the climatic factors, and the outbreaks, incidence, distribution, abundance, and breeding of mosquitoes, transmission intensity, as well as the extrinsic incubation periods are affected. Lyme borreliosis by ticks, and the temperature, precipitation, and humidity are the factors, and the frequency of cases, phenology of host seeking by the vector, and the vector distribution is affected. Then the tularemia by ticks, temperature and precipitation, case frequency and the onset, and the plague by the fleas vector is the flea, and the temperature, precipitation, humidity, and El Nino related events, and the development and maintenance of pathogen in vector, survival and reproduction of vectors and hosts are affected, and the anaplasmosis and the ehrlichiosis, again ticks, temperature and precipitation are the factors, and the vector distribution, phenology of a host seeking by the vector are affected. So these are just few examples of the important vector-borne diseases I have included in that particular table. And here you can see the vector-borne disease mortality and the distribution. Majority of the vector-borne disease burden occurs in the developing countries. And see the position of India. It is in orange color. That means from 50 to 200 deaths per million. And see the condition in Africa and other countries, it is too high. So developing countries are mainly affected. And now few important diseases I have included, that is the emerging vector-borne diseases, prominent invasions of pathogens into new locations in the recent years. First one is the West Nile fever virus in the North America. Then another important problem in Europe is the Bruton disease in temperate climate zones of Europe. Then Japanese encephalitis in Southern Asia, Rift Valley fever in this Arabian Peninsula, and Zika in India. Zika in India, last year also there was occurrence of Zika virus in India. Zika is a close cousin of dengue and chikungunya, and whenever you hear about the Zika, you have to remember this particular picture, the baby with the microcephaly. So you won't forget the research important symptoms that can be of the disease caused by this Zika virus. It is the microcephaly. So it is considered as a close cousin of dengue and chikungunya because it is transmitted by the same vector, your tiger mosquito. So the history first isolated from the monkeys in the Sika forest in Uganda in 1947. Large outbreak occurred in the South Pacific Islands. First human case in 1952. And who is at risk of being infected? Anyone who is living in or traveling to an area where Zika virus is at risk for infection, including the pregnant woman. And actually, the pregnant woman has become all in a dilemma because the joy of pregnancy has given way to fear. The Zika virus spreads fear among the pregnant Brazilians. In about 4/5 of the cases, Zika out of the means only very few cases shows symptomatic thing, and all the other cases goes unnoticed without any symptoms. That means the clinical manifestations will be comparatively nil in case of majority of the cases. So the Zika causes no noticeable symptoms, so women have no idea if they contracted it during pregnancy. That is why all the pregnant women were under so much of stress whether they had contracted the disease during pregnancy or not. So the mode of transmission, Aedes aegypti is the main vector, the main culprit, and the Aedes albopictus also plays a role in the transmission of this disease, as in case of your dengue. So bite from an infected mosquito, Aedes aggressive, daytime breeder, and the maternal fetal transmission also can occur. That means intrauterine or perinatal, both ways the virus may transmit into the neonate, and the sexual transmission also occurs. And in Brazil, health ministry officials advised against pregnancy until 2018 when there was occurrence of this Zika virus infection. A special rule was there, that means not to become pregnant because of this important clinical manifestation, that is the microcephaly. Then laboratory exposure can happen, lab accidents can happen, and also blood transfusion, organ and the tissue transplantation. So this is how it is transmitted. Zika virus from the pregnant women, it may reach to the fetus, then through the mosquitoes to the susceptible host, and the cycle continues. And about 1 in 5 people infected with Zika will get sick. Only that much. Four-fifths of the cases goes unnoticed without any clinical manifestation, and the illness is usually mild. For this reason, many people might not realize they have been infected, and the symptoms typically begin 2 to 7 days after being bitten by an infected mosquito. And the important symptoms include the fever, rashes, pink eye, pain in the joints, pain behind the eyes, headache, muscle pain, microcephaly, miscarriage, stillbirth, and other birth defects. And important problem that can occur or that may occur due to the Zika virus infection is the Guillain-Barré syndrome. Guillain-Barré syndrome, one of the syndrome that can happen in many other diseases, including your Campylobacter. So here it is a disease, and here there will be demyelination of the mitochondria, and hence the transmission of the impulses, nerve impulses, will causing the muscle weakness and sometimes paralysis. That is the Guillain-Barré syndrome, and that is one of the important sequelae of the Zika virus infection. Important thing as the microcephaly, which I was talking about in the beginning itself. You can see, you can compare these pictures. See the size of the head. Actually, when we were studying this about this microcephaly, I was under the impression that the total size of reduced. But see the so from this particular picture, you can see the front side is comparatively in that same size, and so how the typical head size is getting reduced. They did severe microcephaly. The Brazil has already seen 4,000 cases of microcephaly, and the microcephaly can occur because of the baby's brain has not developed properly during pregnancy or has stopped growing after birth, which results in smaller head size, and the baby is born to women who were infected with Zika while they were pregnant. So this is the most important clinical manifestation that can occur due to Zika, by all the pregnant women were under so much of tension because when this Zika virus infection happened in Brazil and in India also last year. Also, the Zika virus infection has happened, but there was not much symptomatic, not much symptomatic. It goes unnoticed without much problem. Now, next is the West Nile fever agent, is the flyvirus. You all know the vectors are the Culex pipiens and the Vishnue complex, and the birds are the natural host, and the horses and the humans are the dead end host. And the routes of transmission again through the mosquitoes. The virus may also be transmitted through the contact with other infected animals, their blood and other tissues. Then organ transplantation can happen, blood transfusion can happen, breast milk through the breast milk, and one reported case of transplacental mother to child transmission also can happen. And the laboratory acquired through the lab accidents. Through the lab accidents also West Nile fever. So the mosquito bird cycle from the dead end host, host is the dead end host, and human is also the dead end host. The main cycle is between the birds and the mosquito, that is the West Nile fever, and the clinical is asymptomatic in around 80% of infected people. So that is the lucky part. In Japanese encephalitis also it is like that. 75% percentage, there won't be any problem. Then the febrile illness, headache, body ache, joint pains, vomiting, diarrhea or rashes. Then the severe symptoms include the encephalitis or meningitis, headache, high fever, neck stiffness, disorientation, coma, tremors, seizures, or the paralysis. And about 10% of the people who develop neurologic infection due to West Nile virus will die. So this is the diseases in endemic or the potentially endemic in 83 countries. So this brown this thing color indicates the high occurrence annual disease rates per one lakh population. And the climatic variable chiefly with viral replication, the temperature, the viral replication will be increased, the growth rate of the vector population increases, and transmission efficiency to birds increases. Shorten the incubation time from infection to the infectiousness in mosquitoes. That means the extrinsic incubation period gets reduced when there is increase. In case of West Nile virus, precipitation, effective precipitation above average precipitation leads to higher mosquito abundance and the positive association between the heavy rainfall and the higher incidence of West Nile fever virus in the US. So that is the effective precipitation. And below average, that means if there is drought, shrinking of the remaining water grows eutrophic and favors there is chance for increased nutrient content in whatever remaining, and that may favor the Culex pipiens. Standing water attracts several and birds and facilitates epizootic cycling and amplification. And the relative humidity effect correlates positively with the vector population dynamics, and mobility in humans increases with relative humidity, and wind contributes to virus spread and affects the birds' migration. Now coming to the Japanese encephalitis, and is important vector-borne disease, important example for the metazoonosis. So the genus Claviva mosquito include the Culex Vishnue complex, Vishnue, Culex pseudo Vishnue, Culex tritaniorhynchus, and tritaniorhynchus is the most important culprit. And the pigs are the amplifier host, we all know very well, and the host are the birds, especially the migratory birds, the horses, cattle, sheep, goat, and humans. And the transmission and the pig's mosquito cycle and the bird mosquito cycle, and the human it may get transmitted. That means the then host or the human accidental host, we can say. And this is the Japanese encephalitis, and India is also see them. India is also area in about the Japanese encephalitis. And the clinical signs again, more than 1% of the people, only less than 1% of the people develop clinical disease, and the incubation period that is the lucky part in most of the disease, important viral diseases. And the incubation period is 5 to 15 days, and the symptoms occur in 3 stages. First is the prodromal phase, sudden onset of fever, headache, vomiting, anorexia, and myalgia, and acute encephalitic phase where there occur the Parkinsonism syndrome with the mask-like face, tremor, cogwheel, rigidity, convulsions, incoordination, and paralysis. And as a sequelae, there is chance for the difficulty in moving and the convulsions, and it may occur for a long period. That is the sequelae of this particular disease, Japanese encephalitis. And now the Lyme disease, Borrelia burgdorferi, it is one of the important tick-borne disease, and the Ixodes ticks are the culprits in the transmission of this Lyme disease. And this is the transmission cycle. This is the primary route. So you can see the ticks, and through the mice and all that disease gets transmitted. Beer also plays a role, and again, human is the dead end host in this case, Lyme disease. And the disease in man develops in 3 stages. 3 stages, the disease clinical manifestations occurs in 3 stages. First is the early stage where occur the cutaneous infection, where the bite occurs. There will be erythema chronicum migrans, ECM. 3 to 20 days of tick bite appears as erythematous maculae, then papule develops and followed by fever, headache, and lymphadenopathy. And the papule develops centrifugally, giving a bull's eye appearance, typical bull's eye appearance, and that is the typical lesion of the erythema chronica migrans. And in the next stage, disseminated infection, neurologic and cardiac symptoms, including the meningitis, encephalitis, and myocarditis. And the third stage, chronic arthritis. This is one of the important sequelae of the Lyme disease caused by this borreliosis, and remains for several years. And this is one of the major reasons for the arthritis, especially among the ladies. And this is the typical erythema chronica migrans, the bullseye appearance, and you can see the erythema chronica migrans, the lesions. Now, the malaria, another important vector-borne disease caused by this viral disease, transmitted by the Anopheles mosquitoes, and the cases are about 228 million worldwide, and the death can occur, that means 4 lakhs 5,000 deaths, that was in 2018. That means it is one of the very common disease, and this is the distribution, malaria transmission, the distribution pattern we can see. And 40% of the world population is at risk of getting malaria, and the climate sensitive disease. No transmission occurs where mosquitoes cannot survive, and the Anopheles optimal adult development occurs in 28 to 32 degrees centigrade, Anopheles mosquito, and Plasmodium falciparum transmission. The optimum temperature is 16 to 33 degrees centigrade. Then the dengue disease, Aedes aegypti, the tiger mosquito, and these are the global burden of dengue in 2010. We can see the position of in this, is of 532.5, and the annual infection. So that is in red color. See, this is the global burden of dengue. So to conclude, change could significantly affect the vector-borne disease, and the temperature, precipitation, humidity, climatic factors are known to affect the reproduction, the development, the behavioral pattern, and the population of the arthropod vectors of these diseases. Then the climate also can affect the development of pathogens in vectors as well as population. And the World Health Organization estimates that 1/6 of the illness worldwide is owing to vectors. The 17% of the infections of this category, with more than half of the population is at risk, currently at risk, half of the world's population. Every year, more than 1 billion people are infected, and more than 7 lakhs people die from vector-borne diseases. So that is to conclude, and I to thank the delegates for the patient's hearing, and also the organizers for inviting me and this particular important training program. And I especially thank Dr. Tende, Dr. Vaidya, friends. I am also this Bombay. I am so proud to say that I am an alumni of this Bombay. Thank you, Dr. Vaidya.
Thank you very much, madam, for your very excellent, very interesting lecture. Very clear, actually, your whatever speech is very clear, very specific, attentive, and all the participants that we have seen that they listen carefully, very informative lecture, madam, and definitely this lecture will be very much useful. This information will be useful to the participants. Now I will ask the participants if they have any questions, one, two questions they can ask. They can ask the participants questions, because madam, in madam's lecture about this climate change and vector-borne diseases, she has covered all the aspects related to the whatever the determinants of climate change, then greenhouse gases, the impact of climate change on vector-borne diseases, then concept of ecosystems, drivers of vector-borne diseases, which are at globally, then dynamics of vector-borne diseases, effects of temperature, humidity, and whatever the other factors that affects on the vector-borne diseases. Madam has covered all these different emerging vector-borne diseases. She has given the examples of Zika virus, West Nile fever, Guillain-Barré syndrome, JE, malaria, all these, the whatever the climate change that affects on the vector-borne disease, he has covered all the aspects. Very informative lectures. From participants, if you have one, two questions, you can ask.
Hello.
Yes.
Ah, yes.
Hello. Madam, this is Dr. Dalvi
Huh.
from Biochemistry Department.
Okay.
I congratulate you for a very nice and informative lecture you have delivered. I
Thank
have only
you.
one question
Huh.
regarding GB syndrome.
Huh.
GB syndrome, which specific virus causes GB syndrome? If you have come across any literature, then
Yeah, actually, this GB syndrome, it is one of the sequelae type. So many of this Campylobacter causes a GB syndrome, and many viral diseases also. I have to check the list. Campylobacter is one, and this can occur as a sequelae. Syndrome. You want? I will check list of the organisms which can cause this Guillain-Barré syndrome.
hello. Thank you. Thank you.
Any other participants?
Vaidya, if you can.
Yes, madam.
Other organisms which can cause this Guillain-Barré?
It's a, actually, madam, autoimmune disease.
Yeah,
Yeah, yeah,
no problem. That I can take it out and then.
yeah, yeah. This question is there. In chat box, question is there. Okay. What is that?
For climate change with respect to vector-borne diseases and One Health. In the last presentation also One Health was the topic, and we have a very important role to play in the control of zoonotic diseases and as well as the vector-borne diseases. And nowadays, these greenhouse gases, we have seen the carbon dioxide, what are the important sources of carbon dioxide, we know, and the methane, what are the important sources of methane. We know one of the most important sources of methane is the animal itself. So the so many methods are there to reduce the methane production, the feed preparation. In our university itself, we have a feed mill, and a lot of research work is going on to reduce the to reduce the methane emission by using ingredients in the feed, and a lot of research works are going on incorporating different ingredients to reduce the methane emission. So a lot of important role is there for the vets to play with them as a part of this veterinary public health. Especially we have awareness program on the vector control, especially the mosquito control, and it should start from health, because we always used to tell, that is why we have talked about that program, no zoonosis to no zoonosis, KNOW, no zoonosis program, associated with different schools we have covered. Very easy to teach the students community. It's very easy, will imbibe the things, and once they get the knowledge, they will be passing on to their family members, to their friends, to their relatives, and so it's teach the school children, and with that we can make the maximum awareness about the vector control and all. So we have to play a very important role in the vector control.
I think if Anyone? If I think no questions. Thank you again, madam. Thank you so much for your miss whatever the questions also asked. As you said, Guillain-Barré syndrome. It's a autoimmune disease caused by the viruses. Yeah. And again, another questions also you have answered very well. And the thing is that the thank you very much for your because all whatever the presentations and your leadership, because although in spite of your busy schedule as a director of academics and research, you have given your valuable time to us. That is very much appreciable. Always your leadership, your such dynamic personality, what I can say, because as we worked under you in our this department, always your down to earth personality, always it's a inspirational to us. That is very important thing. Your always guidance, advice, and encouragement to us to move forward is always appreciable, madam. Thank you very much. Although in our association, IU Pitches Association, you are working as a vice president of IU Pitches, so that also you are working hard and always you are advising us. So thanks a lot. Once again, thanks a lot, madam, for your valuable time and great speech. Thank you very much.
Thank you, Dr. Vaidya, and convey my regards to all in Bombay Veterinary College.
Yes, 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 madam. Thank you very much.
Okay, thank you very much.